the bare necessities of CPR for women. Did you know that studies have found that women are less likely to receive CPR from a bystander compared to men? While we are not bystanders but trained ski patrol members certified in CPR, maybe we are not prepared to utilize our skills as easily on women. But what if you are called to a scene where a female patient needs CPR? Do you know what to do? Are you prepared? The first step of CPR on anyone is to bare the chest. That's not too hard on a male. We open the jacket and remove or cut the clothing layers to expose the chest. Baring the chest of a female, however, may give us pause. Do we have to? Yes, the guidelines are clear. It is necessary to bare the chest for both male and female patients. AED manufacturers recommend removing all clothing from the patient's chest for proper AED shock deployment. There must be no delay as survival rates fall with each second wasted. This means clearing the layers of clothing by removing or cutting and includes removing or cutting the bra, so there are no hindrances to accessing the skin for proper AED pad placement. Remember, once you begin CPR, you cannot stop until the person shows signs of life. Other responders take over, or if you are too exhausted to continue. This means that once you begin, you cannot stop to bare the chest later. It must be done at the start. Male or female, there are no differences between the rate and depth of compressions. When the AED arrives, the placement of pads is similar to that for a male. However, the left breast may need to be gently lifted to secure the pad into proper position. And during CPR, the breasts will come into contact with the rescuer's efforts with resuscitation. While the thought of that may be unnerving, please understand the importance of proper placement to help override any insecurities. This photo of a female mannequin in the American Heart Association 2025 BLS Instructor Update e-learning course shows how giving proper chest compressions may result in contact with the breasts. It emphasizes the importance of baring the chest by full removal or cutting the bra to offer the best chance for life-saving AED deployment. Will baring the chest of a female, including cutting the bra, be okay to do in public? Yes, this is more than okay to do in public. It is necessary. Baring the chest is an important step to ensure the AED pads will be set up correctly. Once the pads are in place and compressions continue, a helper may add a blanket for warmth or discretion as long as it does not interfere with compressions. When the chest is bare, we are able to see if there is a pacemaker. Yes, women have pacemakers too. The pads should never be placed over a pacemaker or any medication patches. A bare chest allows us to see jewelry which shouldn't be removed but should be moved aside so as not to interfere with the pads. Also, any connected piercings should be disconnected from each other or cut. Will I be protected against sexual assault if I cut the bra? Yes, you will be protected by following standard protocol. It is standard protocol to remove all layers, including cutting the bra, to expose the chest for correct CPR performance and AED placement. Following standard protocol protects us under the Good Samaritan law and, most importantly, may save a life. You are a first responder using your trained skills to help save a life. Do it properly without hesitation. Review this video and share with others. Performing CPR on a female may draw extra crowd curiosity. If you are on the scene not performing or assisting with CPR, now is the time for you to make every effort to keep the patient and the CPR performing patrol members safe from bystanders' movements, stares, judgments, and video recordings. Hold up a blanket, tarp, or garment to offer privacy, respect, and support to the patient and the rescuers. Ask the public to help by forming a circle, shoulder to shoulder, facing outward. This practice is not just useful for female patients undergoing CPR, but for all patient incidents which are drawing immense attention. In case you didn't notice, there are a lot of different types of breasts, whether natural or implanted, and a lot of different types of bras. Once you are called into action and understand that baring the chest is as important as the rate and depth of compressions and as important as proper AED pad placement around any type of breast, you will feel confident to handle any woman who needs CPR. Any woman who needs CPR will not care how much their chest is exposed or if their breasts are repositioned during the process. She will care that the person helping her is properly trained and not hesitant to apply their skills correctly during this critical time. And any woman who needs CPR will be grateful that she has been responded to quickly, efficiently, and as readily as a man. Know the bare necessities of CPR for women and be the patrol member who is ready for this call like it is your mom, your grandmother, your aunt, your wife, your sister, or your friend. Be the patrol member who is ready to help everyone.